Hello there, Dr. Chris Carter coming at you today, and what I want to do is talk to you about thyroid conditions. Pretty obvious, I have that written on the board behind me, but I want to really talk to you about what needs to be done, the very first thing that needs to be done when working with a thyroid condition. The very first thing that needs to be done is a proper diagnosis done by a physical examination and the proper blood work, okay? Not just a small panel with blood work, not just a TSH, T3, T4 basic thyroid panel, but you need an expanded panel. Folks, because really here's what the problem is. In America, there are two different camps, so to say, that people will fall into. One of these two camps with their hypothyroid problem. Either you truly have a thyroid that is needing a kickstart and needs some supplemental TSH stimulant like in a levothyroxine or Thyroid or Armour, something like that. But here's the thing that most people don't know. 70 to 80% of the people in America that have hypothyroid problems, it's not your thyroid, it's not your TSH levels that you really need to be worried about. It's about an autoimmune condition, okay? It's called Hashimoto's autoimmune thyroiditis. And when you watch my thyroid videos, you're going to hear me talk about this a ton because I really want you to get the understanding that there's a whole world out there of possibilities for why your thyroid problems are the way they are, and it's more than just that little TSH, because TSH is really a small part of this whole thyroid physiology puzzle. The endocrine system and the thyroid in particular are very difficult physiological aspects that we have to work with. There are a lot of different parts to this puzzle, and you can't take one little piece and fit it in somewhere and say, the puzzle's done, we've completed the puzzle, we know what the problem is. No way. If someone has done that with you and your hypothyroid problem that you possibly have, then they've missed the boat, okay? What needs to be done here is the proper testing, the proper diagnosis, and then the proper treatment plan, okay? Basically, if you've been on the medicines for a prolonged number of years and you still feel the same as you did when you first got on them, well, maybe you had a honeymoon effect. But for the most part, if you still feel the same, odds are is that somebody's missed the boat with you and there's a lot more testing that needs to be done, okay? And in my video series, what I'm going to do is I'm going to talk to you about the different testing, the different parts of your anatomy and your physiology that play a crucial role in how thyroid hormones actually get delivered to the cells to do their jobs, okay? But I just really want you to know that looking at TSH is just a very small piece of this puzzle, very small piece. Are there some people that absolutely have to have that piece of the puzzle? There sure are. There sure are. And here in America, it's 15 to 20% of the people with a hypothyroid problem. They need that TSH boost, okay? And if you fall into that group, that's what you need to be doing, all right? And I'm not here to tell you to not take your medicines. That is not my job. That is not what I'm supposed to do. I want to educate you on the other possibilities for why you are suffering with these hypothyroid types of conditions, okay? And we talked about it a while ago, just a little bit. Hashimoto's autoimmune thyroiditis. Go to Google. Type in Hashimoto's. You're thinking, how do you spell Hashimoto's? H-A-S-H-I, Hashimoto, M-O-T-O, H-A-S-H-I, Moto, M-O-T-O, okay? You type that in your Google browser, you hit enter or go, and it's going to come back and it's going to tell you that it is an autoimmune disease that is attacking your thyroid, okay? It's not because you have decreased TSH and you need levothyroxine. It's because you've got this autoimmune condition. And upwards of 80 and sometimes 90% of the people here in America have that problem. And folks, I'm here to tell you, the treatments are totally different, all right, between someone who actually has a low-functioning thyroid and someone who has this Hashimoto's autoimmune condition. And if it's the first time you've heard this here on this video, then shame on whoever's been taking care of you, because they should have educated you and said, listen, let me tell you about the #1 cause of hypothyroid problems here in America, okay? They should have educated you on that, told you the testing that should have been done, and then found out whether you fall into that category or not. What I found is that 95% of the people that have hypothyroid problems have never heard of the #1 cause. That's because no matter what they test you for, no matter what comes back, you're still going to get the same treatment. You're still going to get Thyroid and maybe an antidepressant, okay? And if it doesn't do the trick, they'll say, well, let's change your dosage. Let's up it, see how that affects you. Let's lower it, see how that affects you. Let's try different medications, see how that affects you. Let's give you more antidepressants. Let's see how that affects you. Drink more water and exercise. Let's see how that affects you. Sound familiar? Probably so, okay? I want you to think about this for a second. If you're just continuing to change medicines, change dosages, and nothing's really getting fixed, and no one's really saying, this is your problem, this is what you have, do you think you're ever going to get better that way? That's what I really want you to do. Just come to the realization and go, this is not working, what has been going on with me. I need to find out the missing pieces of this puzzle. All right? And that's what we provide here at my office, okay? We provide those missing pieces of the puzzle by doing the proper testing and finding out what you truly have. And based on those results, give your body what it's asking for. Either things to stay away from or things you need to add to it. But it is based on what is going on with you, okay? And throughout my videos I want you to watch, you'll see the various things that you should do, you shouldn't do. We're going to get into a lot of educational material so that you're more educated on what you need to do to get better, okay? That's what it's all about. Okay, so for today, Google Hashimoto's Thyroiditis, or the #1 cause of underactive thyroid in America. Just type that whole thing in, see what it comes up, see what comes up, and you're going to find out it's an autoimmune disease and it's the #1 cause. I want you to know about this because if and when you decide that you've had enough of chasing your tail around and you want me to work with you, I want you to be very familiar with what we're doing and why we're doing it. Every doctor owes it to their patient to educate them on exactly what's going on. And that's what we're here to do. Okay? If you need more information, you can go to LouisvilleThyroid.com. That's LouisvilleThyroid.com. That's my personal website that I put together. I want you to go through that. Go through each page. If you have a spouse or loved one that is with you on this journey for hypothyroid relief, have them go through with you. Look at the page about me, my past, history as far as education goes, and what qualifies me to talk about the things that I talk about here, okay? I'm glad you watched this. Hope you learned a ton, and continue to look for my videos because we're just going to educate you until you understand what's going on and what needs to be done. Thank you and have a fantastic day.